Hey everybody, today I want to talk to you about the new chair exit alarm modules that we have purchased. So, big thing to know is we as a unit have purchased these, so they do not go back to distribution, they do not go in the dirty utility room. When you're done with them, please wipe them off. They can be wiped off with bleach, and if you're in the intermediate care unit, it will go right back up on the wall because we have one for each intermediate care unit room. And if you're in the ICU, it goes back into the central supply area. We have 5 for the medical ICU and 5 for the surgical ICU. So say you're going to go ahead and use this device, you need to grab the module from wherever you'll find it, whether you're IMC or ICU. It comes with this cable. This is how we connect it into the call system. Know that for some reason not all of our rooms are working with this as far as the call system goes, but the module itself is nice and loud. So should the patient stand up, you will most definitely hear it. The other thing that you're going to need to get is one of the pads. These pads are located in the central supply area, both medical and surgical ICU, and they're a one patient use. They're not to be wiped down or reused between patients, and they can only be good for 30 days. So when you open it up, go ahead and put the date on there, and then 30 days later it needs to get tossed, and go ahead and use a new one for that patient. The connection piece is just a telephone cord. You're going to go ahead and plug it into your box, the base. Go ahead and hook up, make a little loop and hook it into the connection point there. It makes it so that it can't just get tugged out. And then as soon as you're ready, seat your patient on the cushion. The nice thing, you'll hear 2 audible beeps, but the nice thing about this system is that it resets itself. So my patient attempts to stand, the alarm goes off, they sit back down, and it resets itself. The big important thing to know is that when you take a patient to the bathroom or you're getting them back into the bed, in order to make it not alarm the entire time, this little key hanging off the bungee goes right over the little red dot at the bottom right hand of the module. That puts it on standby and it will no longer alarm. So remember, when you have your patient on there, don't be leaving the key on there, otherwise it won't work for you at all. When you're all set, go ahead and bring your patient back, remove the key, sit them back down. You'll hear the 2 audible beeps, and now it's back on again. When you're all done with it, the key does not need to be stored on top of the little red dot there. It can hang freely. All you're going to do is go ahead and remove the cable, hit reset one more time, and you can now wipe down the module and go ahead and put it back into the area that it belongs. If you have any questions, please let myself, Denise, Chelsea know, but it should be fairly simple to use. But let us know if you have any questions.